Peace and blessings. I'm Dr. Bobby Price, aka Dr. Holistic, and I help you heal holistically, naturally, so that you do not have to settle for treatment. And in today's episode, I'm going to teach you how to fix loose, flabby skin after major weight loss. Now, this is a big issue today because a lot of people are experiencing this. A lot of people are especially experiencing this after a surgery or a particular type of drug that we'll talk about in just a second. Now, before we get into it, let me first say this. I first started off my health journey, and when I started that health journey, part of the reason was to lose weight. But for me, the focus was I needed to get healthy first because my biggest concern was that my blood pressure was stroke level, all right? So I put normalizing my blood pressure, getting rid of the sleep apnea, way above the weight loss. Okay, for me. Now I did that incidentally, and what I can tell you is that it was the right way to do it. And I'll explain that in just a second. But quite often, as we get into the causes of why people are having this loose skin and flabby skin after major weight loss, one of the primary reasons is because people are losing weight unnaturally and very rapidly. And quite often when you're going through something like a gastric sleeve or gastric bypass, or you're taking a GLP-1 drug like Ozempic, Wegovy, Byetta, etc., these are the type of drugs that unfortunately are surgeries that often lead to complications, okay? And what people don't think about, and when you use these modalities, the unfortunate thing is that you don't get all of the benefits that come with changing your diet, changing your lifestyle, the boost in confidence, the everyday going to the gym, the everyday eating the right foods. You don't get all of the benefits that come with those things quite often. And the unfortunate thing is that most people, when they go into their doctor is not going to have a conversation with them about this. And the reason why is because they're choosing the same options that you're choosing in most cases. Okay? But the unfortunate thing, like I said, is there is no surgery, there is no drug without a side effect. And we'll get into that in just a second. But this is one of the primary reasons so many people are actually having loose skin and flabby skin after major weight loss. Okay? Number 2, high cortisol levels. High cortisol levels actually will lead to you having loose, flabby skin as well, too, especially when you're going through that weight loss journey. And also, the obvious is that an unhealthy diet and lifestyle, okay? It's important to know and understand that we are what we eat, okay? The same way this house, if I made it out of paper mache, cardboard, and plastic, and a wind came through, the unfortunate thing is that any amount of wind could blow that house down. But if I make it out of bricks and concrete and steel, then this house can last me 100 years, 200 years. Okay, so it's just really important to understand we are what we eat. And so quite often we're not looking at our makeup. And when you think about our makeup as it shifts when you're losing weight, the most important thing is you want to keep your lean muscle, okay? You want to lose some fat. You definitely want to get rid of all waste that is not needed and that is toxic to you. But we're also made of collagen and elastin as well too. And when the skin gets saggy and loose, that is where we have a reduction in collagen and elastin, okay? When you're having rapid weight loss that is caused by not only losing the fat, but also a lack of muscle, that's the issue as well too. When you look at the skin, think of the skin as just the covering, okay? Because again, we're mostly made up of bones, muscles, fat here and there, okay? Elastin, collagen, but the skin is the covering. So when the skin isn't tight, when the skin is loose, it's telling you something not only about, your appearance, but it's telling you something about your inside health makeup as well too. So that's really, really important, all right? The other thing is, this isn't only for people who are on their health journey. This is also for those who are about to start their health journey and they want to prevent getting loose skin. okay? Because we're starting to see this so often. So that's really, really important as well too. All right. So without any further ado, let's jump into it and I'll break down what you need to do to prevent this, what you need to do to recover from this, et cetera, et cetera. All right. Number one, gain health and then you'll lose weight. That needs to be the mindset. Most people go into their journey with a lose weight and then I'll gain health. They think that losing weight is going to naturally create a side effect of gaining health. And so many people that I see who take the unnatural route, they end up losing weight, but they don't gain a lot of health. I'll see a lot of people who, let's say for instance, were diabetic beforehand, and then they go through, get a gastric sleeve or take Ozempic or Byetta or whatever it may be, and they lose a lot of weight, they still have the diabetes, okay? So again, just look at my example. The idea was do what I need to do to gain health, to normalize the blood pressure, to get off the, CPAP, the sleep apnea machine, okay? And then as a result of getting healthy enough to normalize my blood pressure, to breathe correctly when I'm sleeping, the weight loss just naturally fell off. Whereas most people are trying to do it backwards. Now, again, this isn't judging anybody out there who got a surgery, who took one of the drugs that their doctor didn't properly inform them of in terms of the side effects. But it's just really important to know that, again, when you take an unnatural route, a surgery, or even a drug, you do not get all of the benefits that come over time of eating healthy, moving healthy in terms of exercise, and also, doing other things that are healthy as well too. You don't get that sort of accumulation of health benefits, that all of the things that I'm about to talk about today. And in addition to that, you get all the side effects of the unnatural modalities as it pertains to a surgery. Quite often people experience issues around the surgery where they're restricted with their water intake, or as a result of the surgery, now they have bladder issues or they have gut issues. With the drugs, there's so many different issues as it pertains to the side effects that most people don't know about. A 400% increase in risk of bowel obstruction. That means your bowels become obstructed and you have to have a surgery to remove that obstruction. 400% increase. A 900% increase in pancreatitis, okay? Which could not only affect your digestion, but could lead to inflammation and ultimately could possibly lead to cancer as well too, okay? Gastroparesis, which is your stomach literally becomes paralyzed, okay? Most people also don't know that when you take a drug, again, like Wegovy, Ozempic, etc., 40 to 50% of the weight loss is muscle loss. You're losing muscle. So if you lose 100 pounds from taking these drugs, these GLP-1 drugs, 40 to 50 pounds is actually muscle. Muscle is an organ. It is a metabolic organ, meaning it is directly correlated to your metabolism. It's directly correlated to your health. So when you lose muscle versus losing fat, it's a totally different situation. And most people don't know that you're losing 40 to 50% muscle when you're on one of these drugs, as opposed to that number is very different when you're losing it naturally. Okay, so hugely important as well too. So gain health and then you will naturally lose weight as a positive side effect. All right. Number two, build muscle as you lose weight. Hugely important. Build muscle as you lose weight. All right. And what I mean by this is why it's so important to incorporate resistance training, weight training. Okay. You want to build muscle as you lose weight. All right. And this is one of the biggest mistakes that I think people make on their journey. They're on the treadmill doing aerobics, but they're not doing activity to actually build muscle. All right, so that's hugely important. Number three, myofascial training. All right, so your fascia is essentially, you have your muscles and your muscles are wrapped with this almost like saran wrap. It's called the fascia. And when this fascia isn't activated, that also could be a part of why you can't activate muscles, but also why your skin is sagging the way it is as well too. So activating that fascia is very important as well too. And you could do all types of myofascial training as well too. So that's really important. Number 4, remember, you are what you eat. I won't go into that because I've talked about that, but again, it's the house example. You want to build your house of bricks, or you want to build it of paper. All right, you want to build your house with bricks. All right, you want to eat things that are nutritional, that add value, okay, that detoxify you, that cleanse you. You want to eat a supreme diet. So that's really important. So high quality nutrition is very important. All right. Number 5, intermittent fasting. Okay. You want to incorporate intermittent fasting. And what intermittent fasting is a window of time where you do not eat. So let's say, for instance, you stop eating at 8 and then you started eating again around about 11. All right, that'll be about 15 hours of intermittent fasting. Okay, 14 to 16 hours of intermittent fasting allows your body to cleanse, to heal itself. Okay, so that could be very helpful when it comes to tightening up the skin as well too. All right, because once your body isn't eating and it goes into this sort of autophagy, now you get intracellular cleansing. Now you get old dead senescent cells that are removed from the body, but you're also activating all of these intrinsic healing factors as well too. And one of those is going to help with not only tightening the skin, but also burning off waste as well too. All right, so that's hugely important. All right, number 6, occasional 48 to 72 hour fasting with just water. All right, now again, there's going to be some things that, let's say, for instance, you're diabetic or you're on medications, then this is something you need to talk to your doctor about. But if you can do daily intermittent fasting and periodically, maybe once a quarter or once a month or whatever works for you, do a 48 to 72 hour water fast, that could be a game changer, okay? And I think a lot of people just don't understand how important it is to give themselves digestive rest. But in my first book, Vegetation Over Medication, I literally dedicated a whole chapter to digestive rest. So it tells you how important it is. All right, number 7, HIIT training. HIIT training is high intensity interval training. That means that there's high intensity for an interval and then you stop. Okay, so that could be sprint. So you do a sprint and the high intensity is somewhere around 80 to 95% of your max heart rate. So you're sprinting full speed, okay? If that's something that you're capable of doing. If you can't sprint, then you're on a cycle, okay? So high intensity interval training is really good, and here's why it's so good. Because it increases what is called growth hormone. Why is growth hormone important? Because growth hormones make your muscles grow. And that's what we want to do. We want to make your muscles grow. When I say make your muscles grow, I'm not saying you're going to look like a bodybuilder, but we want to fill in that sagginess, okay, with muscle. And it also is really good because it increases, and when I say it, I mean high intensity interval training, it increases connective tissue, okay? That connective tissue that makes everything connect instead of sag, okay? And it also increases what is called collagen as well too. All right, so high intensity interval training is really good for that as well too. All right, just figure out what works for you and what you can do with where you're at right now, okay? Really, really important. The other thing that I mentioned is lowering cortisol levels. Now, here's why lowering cortisol levels is very important, because when cortisol levels are high, it makes the skin very thin, and it also makes the skin sag, okay? When cortisol levels are high, this decreases collagen levels. Okay, when cortisol levels are high, it increases inflammation and dehydration in the skin as well too. All right, I'll tell you another thing that increases cortisol levels other than stress, okay, which we know cortisol is a stress hormone. Certain medications do it, like steroids, like prednisone, okay? These steroids will increase your cortisol levels as well too. All right, birth control will increase your cortisol levels as well too. And here's the thing about cortisol. Cortisol is a fat storage hormone. It tells your body to store fat, all right? And if you're storing fat, you're not building muscle. Hugely important. Also, what causes cortisol levels to increase is caffeine and alcohol. So you got to decrease or eliminate caffeine and alcohol. Also, poor night's sleep, where you're not getting good quality sleep. This is going to increase your cortisol levels as well too. And then a diet that doesn't have enough healthy fats. So making sure you get your healthy fats and omega-3s in, okay, is going to be very important. So that's number 8. Number 9, you have to correct your insulin levels. Now, a lot of these things that I'm naming, they're actually hormones. Like cortisol is a hormone. Insulin is a hormone. When you throw one hormone off, you throw every other hormone off, okay? And the way that we throw our insulin levels off by going into insulin resistance is by eating a high carb, especially unhealthy carb diet. A diet that is laden with breads, pastas, etc. Okay, so you want to keep your blood sugar levels balanced, okay? Because when your blood sugar levels are high, okay, high blood sugar levels are gonna damage elastin, okay? When you don't have elastin, you're going to have saggy skin, okay? So a lot of people have constant high levels of blood sugar. If you think about the standard American diet, pancakes, bacon, eggs, syrup, and whatever it is else, oatmeal, whatever, all of those things spike the blood sugar levels, okay? So you can see why this starts to affect the skin. And if you're pre-diabetic or diabetic, you start to get this condition in the folds of the body, on the neck. You'll see it a lot of times on people's neck. It'll be dark areas that look kind of velvety. This is called acanthosis. Acanthosis is telling you you have insulin resistance, okay? In the folds of the body, in the armpits, in the thighs, you'll see this acanthosis, okay? That's telling you you have high insulin levels or insulin resistance. And insulin also tells your body to store fat, okay? Not to build muscle, hugely important, all right? And also high insulin levels inhibit growth hormone, which I said tells your body to grow muscle, all right? And then the last one, tip that I'll tell you, infrared sauna or spending time in the sun is very important. Why? Because it increases collagen production. Collagen is what makes the skin tight, okay? It increases the blood circulation, okay? That fills the skin in too, so that the skin isn't sagging. And also increases elastin production, all right? So infrared sauna is a game changer. It's something that I do at least 3 times a day. 3 times a week, sorry about that. So 3 times a week when I go to the gym, sometimes 4, I go into the infrared sauna. All right, you can also get this at home as well too. Now the last tip I'll tell you is just realize that this takes time. You cannot think that this is going to happen in 2 days like Amazon Prime. It's not gonna happen in 2 days. But if you put forth consistent effort, let's say over a year or 2, okay? And if you do it really correct, while you really focus on your diet and exercise and all of these things that I said, that year or 2 can be shrink down, dramatically, okay? But health is something that you have to gain, you have to earn every day, all right? So don't look for this to happen in a month and then stop what you're doing. Look for this to be a lifestyle shift. Okay, and when you shift your lifestyle, the benefits always come. All right, so make sure you hit that like button, share this with somebody do you think that it will help them. Hit the subscribe button, that'll let me know you're loving what you're seeing on the channel. And until the next time, peace and blessings and Godspeed.